Good morning, everybody. How's everybody feeling today? How we doing? Good? Thumbs up, thumbs down, lots of thumbs up. Very good. Anybody hit the tables last night, do any gambling? Anyone? Anyone? Little bit? Okay. The better question, the more important question. Anybody win anything? Some's better than none. Sir, you had your hand up. What'd you win? Oh, okay, you played. Did you just break even? No. That's okay. That's when we say, well, it was all for fun. It's okay. Anybody else win anything more or like over $5? No. Okay. Well, beginner's luck is real sometimes. Maybe give another shot later today. Maybe you'll get lucky. Welcome back, guys, to day 2 of our Health 2.0 conference. We're so glad that you're here, and we have another just great, fun, and educationally packed day for you, full of keynotes and panels and networking. So we're just so glad to be here with you. Want to remind you, any pictures that you are going to be taking, please make sure to do the hashtag health, the number 2, CONF. Very important to help us help you maximize the networking that you're doing here the next few days. It's also going to be a great way for us to share your posts and your content to help share your personal brand and business as well. So before beginning our exciting and interactive sessions for day 2, also want to remind you that if you haven't done so yet, to follow the Health 2.0 conference on social media. I'm going to give you 1 minute. I know we all have our phones next to us. If you guys haven't checked in yet to LinkedIn, make sure you find the page. You're just going to type in Health 2.0 conference, and you can share that you're here. Make everybody jealous back home that you're in Vegas and you're learning a ton. Doesn't get any better than that, right? Except for maybe hitting a buffet. That'll be the cherry on top. Well, with that, let's get this party started. I'd like to first extend my gratitude to our gold sponsors, Analytic and Outcome MD, for supporting us throughout. Whoop, whoop. Outcome, Analytic, are you guys here in the moment? Not yet. Okay, sending all our love to them. And guys, they do both have booths inside of the exhibitors area, so please make sure you stop by, see what they're all about, and see how they can best support you and your business and your team as well. Now we have a fireside chat lined up for you. Automating immunizations, the easy way to improve public health reporting. In this fireside chat, we'll be learning about some new challenges with each passing day. Our speakers will throw light on how to track and boost immunization rates by automating the process. We have Dr. Eboni Dotson, founder and CEO of Healthcare Strategic Consultants, LLC. And we also have, we've gone from 3 to 2, Anmol Ghotra, product leader for Nomad Health. I would now like to bring them both up. Come on up, guys.
Good morning, everyone.
Hi.
How's everybody?
Morning, everyone.
All right, so we're gonna just jump right in. We anticipate this to be an informal chat between Anmol and myself. As Melissa mentioned, we're down 1 team member. Tyler could not be here, she's ill. So we're just gonna talk very informally about automating immunizations.
Right.
So wanna just jump right in. Anmol, tell us a little bit about what does it really mean to automate immunizations?
Yeah, so before I jump into that, I just wanted to quickly give my background. So I'm a product manager that's been in the health tech industry for 9 years. I've worked extensively for a very long time with a very major EMR brand, and I might have upset some doctors in here just now by saying that. But I've also worked in the clinical pharmacy setting as well, developing processes around prescription management. And then more recently, I'm with a company called Nomad, where we help healthcare professionals basically, find travel jobs. So I'm taking a break from the clinical side. Going back to the question around what does it mean to automate immunizations, what I think is it's actually developing a process. A process basically, to me is that involves people and tools. So if you think about people that are involved in the immunization process, you have the patient, you have the caregiver, you have institutions, both the health system organizations and governing bodies. So I think it's a process that, and then obviously the tools, right? So whether it's your technical tools or the actual physical syringes, right? So all these things sort of come together to basically give the patient the care that they need in terms of, administering the immunization. With that being said, I think what we need to do is, or what my definition is, that you need to put people and tools together where we develop a habit of bringing people together to really get the immunization to the patient as and when they need it on a frequent basis, if it's one of those recurring vaccines, and have a robust reporting to the appropriate bodies so we can track the efficiency of it and then, better make informed decisions around it.
Right. So I heard a couple of things in that, Anmol, that you highlighted. You mentioned process, but you also talked about people. And so I want to kind of flesh that out a little bit more to understand how important is buy-in when you think about implementing new processes, particularly in healthcare.
Yeah, I think it's absolutely important, again, at all levels. And when I say all levels, I go back to, the people that are involved, right? So you need to have buy-in from the governing bodies, the health institutes, and obviously the clinicians as well. I would even make the argument you need buy-in from the patient as well, right? Because we live in a world where information is now dependent on what your source is, could be clouded, or so I think what we as a group, as everybody who's involved in the process, need to come together, make the process a little bit more clear for the patient to understand, and what we need to do is give people the right tools to administer these immunizations as and when it's needed.
Absolutely.
Yeah.
So I know we have obviously a recent example that we can point to in COVID. We were tasked with, as healthcare workers, making sure that we were able to immunize as many individuals as possible with the COVID vaccine. Talk about that process a little bit. What was your experience? Were you involved at all in that?
I'd say, I was working in a hospital care setting when, when COVID hit in March of 2020. We basically had to change a lot of our protocols around how not only we delivered care for these COVID patients, but what would be the follow-up, care would be for these patients. So one of the things we did was that of all the patients we discharged, what we did is, when the vaccine was rolled out in early 2021, because we had information, contact information of all these patients, what we did is we reached out to them and we said, hey, you were in the hospital for, COVID. There's a vaccine available here, so, some reference information around it, how you can get it, and really sort of, set them up where they can either find their local place, whether it's, a pharmacy or a hospital where they can get it, and really what options they have, depending on which route they wanted to go with. So I think, I can speak for New York State. I think New York State had a pretty good rollout plan for the most part. Being from New York City, we used our stadiums as a way to basically schedule your appointment and go get the immunization. So we did include reference information like that. And then we also, said what are some of the known side effects for, your doses, right? So that was also sort of included in the information packet that we sent out. This basically kind of, going back to earning the trust of the patient, kind of said hey, you can't expect, feverish or chills. So, but that's okay because that's expected from, from some people on the doses.
Okay. So you mentioned, again, I'm kind of going back to your original response and digging a little bit. But you mentioned reporting. Talk to me a little bit about maybe universal reporting or documentation and how that might be used to improve workflow.
I think what we did was, again, I'm going to use New York State as an example because I think that's what I'm most familiar with, and that's where I work. So with New York State, the way it was handled was that depending on where you got the vaccine, it was reported up to the state. So you did get the official, COVID vaccine paper card. And then New York State was keeping track of pretty much everyone who got the vaccine, whether it was 1 dose or 2 dose, depending on the type you got. The other thing was that it kind of helped people keep track of their immunization records too, because when people went out, to bars, clubs, and things, they were able to show the New York State app, which was the official app, as the only trusted source. That was one of the trusted sources that was used in New York State to show that, hey, you did in fact get the vaccine. So it made the reporting of it made it easier for other institutes to say, okay, this person in fact is immunized, and we can sort of accept them into our facility or wherever that is. So I think it was beneficial in that format.
Okay. It sounds like New York was sort of maybe a good example
Yeah.
of what to do. Are there examples that are maybe not as good in terms of reporting or standardization of the vaccine and
Yeah.
how that impacts maybe patients?
Yeah, I can use myself as an example. When when I was younger, and then I was getting my vaccines, it was a way different experience. I think we have come a long way from there, where we everything was tracked on paper, and then if you lost that paper, it was basically you had to basically go through the entire process, or depending on what age you are, you had to get some of those vaccines again. And I know we now have tools like EMRs and EHRs that basically track a lot of these. And then some of the challenges around that the EMRs present is going back to yesterday's discussion, right? You have all this data that kind of lives in siloed systems. Now, if I were to change states to, let's say, Jersey or Pennsylvania or somewhere further out, where they don't share data with the same system that has all my immunizations, like, how do we sort of get that, right? And I'm sure the data is retrievable, but how easy it is and how accessible it is I think a discussion that sort of extends from yesterday.
Absolutely. So
Yeah.
that brings into the equation sort of the accessibility of the information, but also the efficiency of the process for the patient. So if I'm a patient and my information isn't accessible, it sounds like I'm going to have to redo maybe.
Hopefully not, yeah.
Okay.
Yeah.
Well, I would hope not, but it definitely sounds like there are ways to use automation to our benefit as opposed to paper. You also highlighted, you talked about, you kind of like blurred over this word a little bit, and I want to highlight it because I think it's important. Trust. How critical is trust when we talk about moving from paper to more automated systems and processes relative to how patients interact with the systems?
Yeah. I think trust starts from the clinicians, right? We have clinicians that are basically, want to give the best care to the patient, right? And then there are, again, considering the world we live in, there are instances out there where people may not trust the person, right? So I think what we have to do is we have to become more, sort of like a widespread group around multiple sources, and then we have to get more consistent around these multiple sources, sharing, the efficacy and the benefits that immunizations provide. So a lot of people, are skeptical sometimes. We had the COVID vaccine most recently, and a clear example there. So I think what we could have done better in that example is that more sources coming out saying, hey, this is something that works, this is something that's been tested. Pfizer vaccine, I remember the original reporting was tested on well over 60,000 patients across multiple age groups, right? So fairly safe vaccine. I think the original number was somewhere around 94% efficacy. So but we had, one or two sources that were saying this. And, because we live in a digital world where people can reach other people in so many different ways, I think that's what we need to do, is that find more ways to reach our patients to say, hey, and have deliver a consistent message saying, hey, this is the right thing to do, or this is in fact the right, thing to move forward with.
So I work a lot with community organizations, healthcare practitioners, and professionals throughout the state of Georgia. But I know when I'm doing that work, one of the things that comes up often is the lack of opportunity for the community to weigh in on the development of these processes, or be able to just talk to what their experiences would be. I know James mentioned yesterday, he said the answer is always
In the clinical workflow. Yeah.
But for me, the answer is always in the community, right? Why aren't we involving the patients and the communities in some of these discussions to understand what their needs are and how we might create systems and processes that would actually be beneficial to the patients and or be systems or processes that they would want to use. Any thoughts on that?
Yeah, I think, again, living in New York City, I personally observed, areas of New York City where you have certain communities where we saw when we looked into the data, they would visit a hospital or a PCP when something, would go wrong, right? So either they got sick or something, some chronic illness that they faced. So those were the only touch points that they had in a given, medical facility with a healthcare provider. What we saw in some of the other areas were that you had, more consistent touch points in a healthcare setting, right? So you had people that went to their doctor, twice a year for their annual physical or, a follow-up. You had people with, that have chronic conditions that were having, these quarterly or bi-monthly meetings, and then they also had basically, fewer visits around hospitals when they actually needed it, right? So I think a lot of it also around getting people the resources and the education. So what I mean by that is that, we were so busy with our, our day jobs where we don't, and some of these communities don't unfortunately have the time to get involved in those methods of, becoming aware that, health is important and I should be able to keep track of where I am and what I need to do to keep my health in good condition. So I think some of it also has to be around education and again, I think sometimes language barriers also come into play. So coming up with community programs which promote, keeping your health in check, going for that annual physical, getting that, annual blood test is going to be one of the ways how we can, improve community input.
Okay.
Yeah.
Are there any tech solutions available that you, I don't want to say personally recommend, but maybe that you could speak to here that maybe the people in the audience would love to hear about?
Yeah, this is my favorite part about building solutions for large-scale population health. So one of the solutions that we built out in the hospital EMR that was one we did for the inpatient and emergency care setting, and one we did for outpatient PCP. So one of the best ways we can do is, again, I'm gonna kind of reference our friend James from yesterday, is like the answer sometimes does live in the clinical workflow. So the way we did is like pretty much everyone that's getting discharged from a hospital goes home with discharge paperwork, right? Your discharge instructions. Usually it's a pretty in-depth summary of, hey, here's what you came in with, here's what we treated you for, here's some of the medications you're going home with. Nurses and doctors are both pretty prominent part of this process. So what we did is that during the discharge paperwork, again, everyone's using an EMR. We basically prompted the nurse to ask the patient, hey, would you be interested in getting a flu vaccine, right? And we only enable this question when the flu season is actually, active, right? If they said yes, go ahead, great. That creates an order for a vaccine. A nurse comes in, gives the vaccine, and the patient goes home. And now we have a proof of vaccine administration in the EMR that gets reported out to the state and other governing bodies. If they say, oh, no, and then, if they say, I refuse it, that's fine too. We track that. We respect everyone's, decisions. And then we also say, hey, I did get it, but I got it, from my PCP. So we basically took that answer as well, and then again, saved it for our records. Fast forward, what happens is that next year, when let's just say if they came into the hospital again, we can, go back to the data and see what they had. They say, oh, we saw that, you got a vaccine from us last year. Did you get one again this year, right? And then basically the process gets repeated itself. So this is a clear example of EMR being used as a tool to assist our clinicians in helping deliver better care.
And so I'm thinking, because I know that many times EMRs don't talk across states or across facilities or across care settings, how do we fix that? Do you have any thoughts?
Yeah, I think that's the million-dollar question. I can personally attest to this issue because I had somebody in my family who had surgery recently, and they had to get all this pre-surgical testing done. Their PCP was using a different EMR. The hospital where he was supposed to get surgery was using a different EMR, so you can imagine all the hoops we had to jump through. I want to go back about 10 years when the ACA bill was approved, and what it really did was it really helped, it's actually incentivized hospitals to move towards from a paper chart to and what that did was basically propelled the revolution of healthcare data, right? I think most people here would agree that about 20 years ago, we didn't have a lot of healthcare data, especially population health data. But if we look back about 10 years when EMRs really became the sort of the center, we have all this non-clinical data. So now I think the challenge is that how do we get these companies with their proprietary policies to share their data? And I think we might have to look to another either incentive or some form of regulation where it promotes the sharing of the data across systems while maintaining PHI standards, of course, where it's easy for a patient, whether they're going next door to a doctor or across the country, to be able to see that data, from one computer screen to another.
Okay. I have one last question,
Yeah.
And it's a selfish question before we open it up to the audience to see if they have any questions or would like to contribute to this discussion. But one of the many hats that I wear is teaching. And I teach at Morehouse School of Medicine in the Health Informatics program. And so as I'm training this next wave of thinkers and problem solvers, what are some of the things that we need to embed sort of in the training and the curriculum for those individuals to know that when they enter the workforce, there are problems that need to be solved, such as automating immunizations or creating EMR systems that do talk across lines, whether that's the care setting line or a state line or what have you. Any thoughts?
Yeah.
Any recommendations?
I have two thoughts around this personally. I think technology should be there to assist a clinician in helping deliver the care. And I say this because we're moving towards, just taking healthcare out of the picture, anything else you look at, right? Finance, marketing, or anything else, they're more heavily reliant on technology because they have set certain rules on how, business or workflow is. That's unfortunately not the case when it comes to healthcare. And every patient and I think every doctor sitting in here can attest to this, right? every patient can react differently to a medication, or whatever disease they have could be treated a little bit differently compared to a different patient, right? So I would tell them that, hey, use this tool to assist you, but you still should be making the decision at the end of the day. And the second thing is, and this is what I think is part of the problem with the digitization of healthcare, is that we have more people spending time in front of the screen than with the actual patient. So I would tell them is like, just turn this way and actually talk to the patient while you're, because that's what they're there for. The patient doesn't know what's going on the computer screen, right? But you do. So I think it's a level of communication that needs to be improved when interacting with the patient. So those two things is what I would. Long? Yeah. Okay. I'll say those two things would be what I would.
I think you have to
All right.
turn your
Yeah, I
head.
think I might have to turn this way.
Okay. I think that's good advice.
Yeah.
I do think many times when we talk about patient care, we forget that the patient is the part of the care.
Right.
So having conversations with them is critical. So I'm going to stop there and open it up for questions. Do we have any questions from anyone in the audience? It's a race. The
right.
mic. Oh. Well, there are two behind you who made their way to the mic, so we'll come back.
So I got a couple quick questions. The first one is that when you're looking at this as sort of a tool, the first thing that popped into my head is, would this type of system replace something like VAERS? And VAERS is the Vaccine Injury Reporting System, which, according to the 2017 Pilgrim Harvard study, was reported at only 1% of estimated total vaccine adverse reactions. And the reason is it's too darn hard to go through that system. So if you want to automate an element of vaccines, the whole issue of adverse reactions is becoming very important. There's got to be a way, and I'm thinking that's what I'm hearing from you, to streamline a process where a doctor or a clinician can go in, and instead of spending 3 hours trying to figure out how VAERS works, you've got a system that you can plug and play in 10 minutes. Am I correct in?
Yeah, I think my thoughts around that is that I think reporting is a key piece to this. So you have, let's just play this out, right? So you have a patient that goes to a doctor or a hospital, they get their immunization, that gets recorded and sent, that information gets sent to a governing body, right? Let's say if that patient also, experiences some adverse effects, I believe that's also should be reported, and I don't think we're there yet, or I think that, at least as far as I am aware, that the effects or the follow-up effects are not being reported, to those appropriate governing bodies.
Right. VAERS is, from what I understand, VAERS is a very, very, very difficult system to navigate if you're a nurse or a clinician. So hopefully you're going to streamline that process. And the second thing you talked about was trust. And this whole COVID issue has really, I think, put a nail in the coffin of a lot of people in terms of trusting the whole issue, where they're only doing vaccines versus, I mean, the Joe Rogan experience with his ivermectin just created this national fury. And there's a group of doctors in Detroit, Michigan that published very early on the effects of vitamin D and vitamin C, and their paper was retracted. So when you're talking about the whole trust in the system, is your algorithms or whatever going to be something where people will find it just much easier to sort of navigate the system in general?
I think, so there's two thoughts around this. I think we have to make it easy for people to access this information, and I think what we don't do enough a good job is the CDC, I think there's some things that did great during the COVID, era, and then there's some things that didn't do great. I think it was being more consistent around, how we deliver that message, right? So what I would do is that I would say is that we need more sources that are verified to say, hey, And then again, these sources need to reach all types of populations, right? To say, okay, whether you're in the Northeast or whether in the South, whoever the audience is, they need to reach them and with a consistent message, right? So someone that's in the Northeast or someone that's on the West Coast, I believe should be getting the same message. The second thing I like to say is like, well, if you, God forbid, if you get a heart attack, right, or something bad happens to you, you're going to go to a hospital, right, to get care taken for you. These are the same people that are telling you, hey, get the vaccine. So if you trust them with a heart attack, why would you not trust them with a vaccine, right? So that's the argument I like to use. So I feel like we had opportunities to be more consistent in delivering the message. And the second thing, and I think this is the most important thing, is that science and vaccine development, it's based on data. And in the beginning, we didn't have data, right? And we didn't have and as we were treating patients, the treatment plans evolved over time, and we adapted, right? Because we figured out what worked and what didn't work for the patients. And I think that also needs to be a message where you can say, okay, in January, this is what we knew and this is how. In March, we learned this, so we're going to update our treatment plan or our data to reflect that. And I think that's another key part of the equation to helping.
I want to just jump in on the last gentleman's question just slightly on the trust piece. Because again, I think something even more fundamental than that is understanding the communities that don't trust. Why don't they trust? We have a lot of undoing that needs to occur in the healthcare and medical space that I don't think we talk enough about. I think Dr. Nguyen, who was up here yesterday, kind of alluded to addressing racism, addressing bias, addressing how we train AI systems and the things that we're talking about implementing in these communities. And I think until we're willing to have those conversations, until we're willing to actually be in those communities and engage with those stakeholders to say, what is it that you need and how can we build this system to support your needs, I think we're gonna kind of always be going backwards in a sense when we think about the systems that we've created.
So a lot of what you're really talking about is how you make it easier for people to do the right thing, both providers and the patients, the clients that we're serving. And again, I call back, yesterday I mentioned the book Nudge. That's really taught me a lot and got me thinking a lot about things that we had done. So during COVID, we did church events. And the minister would get up, talk about an influence, and say, it's your duty as a Christian to get your to protect your family. By the way, the Parkland van is sitting outside. You can get it at church today. We did those. We helped providers create alert systems. In one of our systems, not immunization related, but asthma vaccines, we put an alert in for high-risk asthmatics that said, remember to prescribe the inhaled steroid. We increased the prescribing in 2 practice settings by 50%, but only 10%, one of them, the amount of fills only had 10%. In the other one, it increased 75%. What was the difference? The one where it increased by 75%, they've actually filled the prescription on the site. In the other place, the patients had to wait 2 hours to get their prescription. Nobody waits 2 hours. There's just a couple of them. I got a whole bunch of ones that we tried where we got our immunization rates up. And in Texas, I would point out that the Medicaid population has better rates on the Medicaid managed care organizations have better rates on half of the HEDIS measures than the commercial population. We've addressed the disparity issue in a creative way, and that I think is not highlighted when we talk about all the other disasters we have in Texas and politics. So thank you.
Agreed.
Thank you.
Yep.
Thank
you.
Okay. All right. I think this lady right here. No time. Sorry. you can
Discuss
just see us
offline, yeah, if you want.
offline, and we'll
Yeah.
answer your question.
Great.
Thank you guys for your
Thanks,
time
everyone.
and attention today.
Yeah.
If you'd like to connect with us or have additional conversation, Anmol and I are sitting in the back. Thank you so much.
Thank you so much, guys, for sharing that insight and for all of your questions. Yes, please be sure to go see them during the break to continue the conversation.